Hi, my name is Dr. Cheryl Burdette, and I'm the director of the clinical curriculum for Origins Incubator. And every week we dig into interesting topics. And so this week we looked at sub-abnormal or slight abnormalities in things such as calcium and parathyroid. And one of the major things that I took home from this week's discussion is just how much good we do when we actually stop and spend time with a patient. If we're talking about the standard model out there that statistically speaking provides about 7 minutes per patient visit, it's very difficult for the clinician and the patient to really sit down and look at data in detail, to see more nuanced patterns. And this was really clear in terms of the discussion that we had this week in terms of, for example, calcium that's either high normal or maybe right at the upper end of normal, 1 point above. And then from there, when we think about elevated calcium, of course, the next step is to look at parathyroid. And we examined some case studies in which the parathyroid was to the higher side of normal and not low. So the pattern, of course, that we would expect is that when calcium is high, that would suppress parathyroid, so we don't further decrease bone breakdown to increase calcium, increase uptake, decrease excretion. And so what about this pattern when calcium is very borderline high, but parathyroid is within the reference range when really it should be suppressed with that type of level? And so the discussion around when we really sit down and talk to the patient, how it is appropriate to refer out from there to make sure that there is no hyperplasia or worse, some type of lesion there. And we had a discussion around this and how a number of colleagues had found evidence of lesions there, early warning signs, and were able to prevent things like a parathyroid cancer because they took the time. And really in Origins, when we teach the membership model, this is largely what it's about, having that time for the patient to really be able to look at things like that. And then we also discussed how other reasons that you could see an increase in things like calcium without suppression or is because of hyperplasia. And that will happen when there's been a long-term deficiency in vitamin D or calcium. So if that person had had a deficiency and then had gone on to maybe treat, or someone who's had a deficiency of vitamin D, that can cause the tissue in the parathyroid to get larger and also to produce more parathyroid hormones. So we looked at some of these trends and really thought about, when we're looking in these functional reference ranges, what we're able to elucidate. And just very clear, our most powerful medicine is having that time with the patient and really getting to know who we're working with and following the premise of first do no harm. It is such a pleasure to work with Origins in terms of not only the clinical application, but a model that really allows for optimal patient-physician rapport.